Iran's celebration of the 42nd anniversary of the Islamic Revolution this month was accompanied by authorities hailing news that Iran's COVID-19 vaccine campaign had arrived. But the vaccine rollouts did little to reassure many Iranians, like Elham Girami, a university faculty manager eager to get the vaccine for herself and her family.
We cannot actually trust the news about vaccination. When we follow the news, we can hear a lot of different specialists that they talk about vaccination.
For Iranians, the uncertainty stems from a barrage of mixed messages by authorities, who first announced the banning of Western-made vaccines, then announced the purchase of a British-Swedish vaccine that has yet to be delivered. Now they're touting efforts by more than a dozen Iranian companies working on domestically made vaccines. At their sprawling compound just outside Tehran, the Razi Vaccine and Serum Institute invited reporters to what it called the unveiling of its vaccine. But officials acknowledged human trials could take months to complete.
This unveiling doesn't mean that this is a vaccine ready for the world to use. We need to prove that we've produced something effective. Until it's been proven, naturally, there won't be any trust.
To date, the only vaccines approved for use in Iran are 20,000 doses of the Russian-made Sputnik V, a far cry from the supply needed to immunize 82 million Iranians. Dr. Majid Mokhtari, a leading voice in Iran on the pandemic, says he trusts efforts by Iran's health sector to eventually provide an effective vaccine. But until he sees successful completion of human trials on Iranian-made vaccines or access to enough imported vaccines, it's too early, he says, to say which vaccine is best.
Iranians have very long history of vaccine production, but what vaccine, I cannot really, to be honest, I don't know how to answer this. We have to be patient, we have not to rush it.
Elham Girami says she won't take a vaccine, imported or domestic, until she's fully informed.
Personally speaking, when I want to pick something or choose something, I have to study about it. I have to see the truth.
For many Iranians, the truth about vaccines may take a while to decipher.